In this session, we are going to deal with palmar aspect of hand. So we have dealt with arm and forearm region, and so after the wrist joint, we will be having another part in upper limb, that is hand region. And this hand region we are dividing into two surfaces such as palmar surface and dorsal surface. And this palmar surface again will be having so many structures present in it, which is very important for us to understand. And this palmar surface we are going to deal now. In this image you can make out the skin reflected, superficial fascia also reflected, and then we will be removing the deep fascia part of it also. So now we are going to approach a part of deep fascia which we will call as palmar aponeurosis. So here you can make out a highlighted area, that is nothing but palmar aponeurosis. And this palmar aponeurosis we have dealt before in insertion of palmaris longus muscle, which is a muscle among the anterior compartment of forearm, and the muscle palmaris longus, it is getting inserted by merging with this palmar aponeurosis. So this palmar aponeurosis, why it is present in hand, is a question for you people. So this is an region, or this is aponeurosis, which is giving grip to our hand. The fibers from this palmar aponeurosis are going to get attached to the skin overlying it, so that it is going to give a proper grip for the objects which we are going to hold the objects which we are going to use. And then we will be having this palmar aponeurosis going to protect some vessels and nerves which are present underneath it. And this palmar aponeurosis always will be compared with the plantar aponeurosis, which is present in the foot region. In plantar aponeurosis we will be getting 5 septa arising, but in palmar aponeurosis we will be having 4 septa arising. About the details of this palmar aponeurosis we will deal later. Now you just understand it is a triangular aponeurotic sheath covering the muscles and vessels and nerves, and then this triangular sheath is going to protect vessels and nerves. So after removing this palmar aponeurosis, the structure we are going to see is vessel, and that vessel we will call as superficial palmar arch. So here you can make out, after removing palmar aponeurosis, we can see some transverse sheaths also. So we are removing those sheaths also. Above these things we will deal detailedly later. Now just below the palmar aponeurosis, the things which you can see is, we will be having two arches. One is venous arch and another one is superficial palmar arch. So this is arterial arch and this is venous arch, which is present just below the palmar aponeurosis. And just below that we will be having tendons coming from the forearm region, the muscles tendons, that is we will be having digiti, that is digitorum extensor, flexor carpi, flexor digitorum superficialis and flexor digitorum profundus tendons. So those tendons you are seeing here. So that's why we are getting two tendons. One is superficial tendon, another one is deeper tendon. Same way it will be seen in all other parts also. So then we will be having a profundus tendon which is present deep to all this superficial tendon. So we are going to see this superficial arch, and this superficial arch again will be having some connection between radial artery and ulnar artery of the forearm region. So this I will show you. So this is the superficial palmar arch which we are seeing here. This superficial palmar arch, it is going to give a connection between the radial artery from lateral side and ulnar artery from medial side. And about the details of this superficial arch also we will deal later in a simple way. Otherwise it will be little confusing for you people. And after removing the superficial arches of this arterial and venous arch, we are going to approach the muscles, which are very important structures present in the palmar surface of hand. So here you can see some muscles which you can make out clearly, and these muscles are called as palmar muscles. So together in hand region we will be having altogether 20 muscles present. So these muscles we are dividing into 5 parts such as thenar muscles, hypothenar muscles, lumbricals, palmar interossei and dorsal interossei. So in this layer you can see superficially placed muscles such as thenar, hypothenar along with lumbricals. Palmar interossei and dorsal interossei will be just below or deeper to these muscles. So here you can make out in near to the thumb muscle. Those muscle we will call as thenar muscles. The muscles which are related to pollicis or thumb region we will call as thenar muscles, and the muscles related to the little finger we will call as hypothenar muscles, and the other muscles which are looking like worm like appearance, so those muscles we will call as lumbricals. And then below that we will be having interosseous muscle that I will tell you later. So now we will deal with how the muscles are oriented in the superficial layer. So first thenar muscle we are going to take. We will be having around 4 muscles which are forming this thenar muscle. So coming from lateral to medial, first muscle what you are seeing is abductor pollicis brevis. Here you can make out abductor pollicis brevis in the sense it is going to give an action called abduction, and it is a muscle for thumb region and it is a small muscle, so we are calling it as abductor pollicis brevis. The same way in extensor compartment of forearm we have seen abductor pollicis longus. So that same itself I had said you we will be having a pair muscle for this which is smaller and having the same function, and that muscle you are seeing here, that is abductor pollicis brevis. So lateral to medial, first muscle what you are seeing is abductor pollicis brevis. Later we will be having another muscle which is present medial to that is flexor pollicis brevis. So this muscle giving an action called flexion and for thumb finger, and it is a smaller muscle, so we are calling it as flexor pollicis brevis. Then we will be having another muscle which we will call as opponens pollicis. So that muscle it is not seen clearly here. So after that we are going to see adductor pollicis. So 4 muscles will be seen in the thenar area. So this is the thenar area we will call. So 4 muscles are, first one is abductor pollicis brevis, then we will be having flexor pollicis brevis, along with that we will be having opponens pollicis which is not seen here clearly. The other muscle which we are seeing is adductor pollicis. So these are the four muscles which is going to form thenar muscles. Among these thenar muscles we are going to call only 3 muscles as thenar eminence muscle. So those muscles are nothing but abductor, flexor and opponens pollicis. So these are the 3 muscles which is going to form an eminence in that area. So we are calling that as thenar eminence muscle. This adductor pollicis it is not going to contribute for the eminence. So it is just a thenar muscle, not a thenar eminence muscle. So these are the 4 muscles which are seen in the thenar area. Flexor, first one is abductor, then we have flexor, and then we will be having opponens which is held out, and then we will be having adductor pollicis which is having 2 heads. About the details we will see later. And now going for the details of the hypothenar area, that is near to the little finger, hypothenar. So compared to thenar area it is low, so we will be having hypothenar muscles which are again 4 in number. So these muscles are again will be having first muscle in the medial aspect, that is abductor digiti minimi. For thumb finger we are calling it as pollicis, here we are calling it as digiti minimi. So abductor digiti minimi, then we will be having flexor digiti minimi, and another muscle will be seen lateral to it, that is opponens digiti minimi. So these 3 muscles are going to contribute for eminence, that is hypothenar eminence. So we will be having first one abductor digiti minimi, flexor digiti minimi and opponens digiti minimi forming hypothenar eminence. Along with that we will be having one more muscle which is not contributing for hypothenar eminence, and that muscle we will call as palmaris brevis. This is a special muscle because it is seen in the superficial fascia of the palm region. So this is a subcutaneous muscle. Just below the skin it is seen, so we are calling it as subcutaneous muscle. So four muscles are seen in hypothenar area. One is palmaris brevis, then we will be having medial to laterally, abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. These three are going to contribute for hypothenar eminence, where palmaris brevis is excluded. It is not going to contribute for eminence. So altogether now we seen 8 muscles, such as 4 thenar muscle and 4 hypothenar muscle. Then we are going to see lumbrical muscle. So here you can make out worm-like appearance of muscles. So those muscles we will call as lumbrical muscles, and this lumbrical muscles are again 4 in number. For seeing that in better view, we are going to remove adductor pollicis muscle. So if we remove adductor pollicis, then it will be clear for us to view the lumbrical muscle clearly. So here you can see first lumbrical present here. So this is the first lumbrical. From lateral to medial we have to count it. So first is seen laterally, that is first lumbrical muscle, and this is unipinnate muscle. First lumbrical is unipinnate, and we'll be having second lumbrical muscle which is present here, and we'll be having second lumbrical, and then here we will be having third lumbrical, and this will be fourth lumbrical. So second lumbrical it is not seen properly here. What you are seeing is first lumbrical, third lumbrical, and fourth lumbrical. Here we will be having another lumbrical seen, and that lumbrical muscles we will call as second lumbrical muscle. So altogether we will be having 4 lumbricals. Among that, first and second lumbrical will be unipinnate, and third and fourth will be bipinnate. As you can see clearly, 2 fibers are arising. So this lumbrical we will call as third lumbrical, and this one we will call as fourth lumbrical muscle. And first lumbrical and second lumbrical, which will be seen here, those two are unipinnate muscles, which will be having unidirectional muscle fibers. So that's all about the lumbricals which we are seeing here. Now we will move on to deeper layer muscle, such as palmar interossei and dorsal interossei, and here now we finished around 12 muscles, that is 4 thenar muscle, 4 hypothenar muscle, and 4 lumbrical muscle. So now we are going to see deeper layer in the palmar surface. So we are going to deal with palmar and dorsal interosseous muscle. Interosseous in the sense, osseous means 2 bones, and between the 2 bones we will be having some muscles or ligaments we will call as interosseous, in between or intermediate to both the bones. So interosseous muscles we are going to see, which is present in palmar and dorsal surface, where here you can view dorsal surface muscles also in the palmar surface after reflecting all the superficial layer muscle. So here you can see palmar interosseous, as I said, it is 4 in number. So this palmar interossei, first palmar interossei will be seen here near to the first metacarpal bone, and it is arising from the ulnar side of the first metacarpal bone. Here it is not seen properly. You have to remember, from the ulnar side of the first metacarpal bone we will be having first palmar interosseous, and then we will be having second palmar interosseous here, and this is second palmar interosseous, and third palmar interosseous will be seen here. Here you don't see the markings, it is wrong. And here we will be having first palmar interosseous, this is second palmar interosseous, this is third palmar interosseous, and this will be fourth palmar interosseous. You have to remember one thing, we will be having first and second palmar interosseous taking origin from the ulnar side of first and second metacarpal bone. But third and fourth interosseous muscle, it is taking origin from the radial side of fourth and fifth metacarpal bone. Here you can make out. So in the third metacarpal bone we will not be having any attachment of palmar interosseous muscle. So altogether we will be having 4 palmar interossei. Now we are going to see dorsal interosseous muscle, which also will be seen in the palmar aspect only after removing all the other muscles. So here you can make out from again lateral to medial side. First muscle what you are seeing is dorsal interosseous. So we have first dorsal interosseous introssei in the lateral part, and then we will be having second dorsal introssei between the second and third metacarpal bone, and then we will be having third dorsal introssei between the third and fourth metacarpal bone, and also we will be having fourth dorsal introssei between the fourth and fifth metacarpal bone. So in this way it is arranged, dorsal introsseis, and here you have to remember all dorsal introssei are bipinnate muscle and all palmar introssei are unipinnate muscle. So that's all about the details of the muscles present in the palmar surface, and about the detailed account of all these muscles we will deal now. Now after that we will go on to nerves, vessels and their importance. So palm, if you are seeing, it is the an anatomical position, we will be having palm as the anterior aspect. So in hand we will be having two surfaces such as anterior and posterior surface, and anterior surface we will call as palmar surface and posterior surface will be called as dorsal surface. So about the palm and the important structures present in it we are going to deal in detail. So already I think you people are oriented with how the arm and the structures present in it are arranged. So now we will see a detailed description about those structures, how it is present. So in palm region, first thing, what is palm? So it is a region which is used for grasping and it is a tactile organ. So the skin present in palm region is thick for protection and it is immobile and it is greased. So the greased nature of the skin will provide or increase the efficiency of grip. So these are the actions made by palmar surface of the hand, and because of doing all these functions we should need the skin present in the palmar surface should be thick, and the things are, it is immobile, and these are the definition of how the palmar surface is present. So now we will move on to the basic features of palm. So in first picture you can make out some greases or lines present in the palmar surface. So in palmar surface you can see some lines, that those are transverse lines which are called as palmar greases. So these are the greases seen in the palmar surface, and then we will be having fingers, and that fingers we will count from lateral to medial. We will be having 5 digits. So in each digit we will be having 3 parts. So except thumb region we will be having only 2. So those are nothing but it is intimating phalanx present there. So we'll be having phalanx bone present in that region. So except thumb region all other fingers will be having 3 phalanges. So first we will be having distal phalanx, middle phalanx and proximal phalanx. Between each phalanx we will be getting a joint called interphalangeal joint. Then if you are seeing the second image, you can make out the inner anatomy of hand region, that is in the palmar surface. You can make out bones such as carpal bones near to the wrist joint, and then we will be having metacarpals. Later we will be having phalanges. So in 4 digits, that is medial 4 digits, we will be having 3 phalanges in each digit. But if you are seeing the thumb finger, that is pollicis, you will be having 2 phalanges, and between each phalange we will be getting a joint called interphalangeal joint. So these are the 2 joints which is present in the digits between 3 phalanges. Then if you are taking metacarpal bones, between the metacarpal and phalanges we will be getting another joint which we will call as metacarpophalangeal joint, and another joint will be made between the metacarpal and carpal bones, and that we will call as carpometacarpal joint. So that's all about the joints present in the inner anatomy of the hand region near to the palmar surface, and now we will move on to the details of all these things. So now talking about the carpal bones. So if you are seeing carpal bones, this is wrist joint what they shown. So in this wrist joint here we have radius and this is ulna. Just below the radius and ulna in the distal part we will be getting carpal bones which are arranged in 2 rows such as distal row and proximal row. In each row we will be getting 4 carpal bones. So altogether we will be getting 8 carpal bones present in our hand, and these carpal bones will be having some specific names for each one. So you have to remember those things very easily by using a mnemonic called "She looks too pretty, try to catch her." So we'll be having 8 bones and 8 letters you have to remember. So first one is S, that stands for she. In that way you have to remember. If this mnemonic is very easy for you to remember the names of each carpal bones, such as she looks too pretty, try to catch her. So the names of the bones we will see now. So proximal row bones we are going to see, which we are going to see from lateral to medial aspect. So from lateral to medial aspect, first bone what you are seeing is scaphoid bone, and then we will be having lunate. But before that, you can see a tubercle there just above the scaphoid bone. You can make out a prominent area, and that prominent area will be called as scaphoid tubercle. So scaphoid bone with scaphoid tubercle, that is the first bone which you are seeing, and the second bone will be called as lunate, and the third bone which is present medial to lunate is tricutral, and the fourth bone which is present just above or near to the lateral medial aspect of this tricutral, we will be having pisiform bone. We will be having some importance for this bone which we will see later. So lateral to medial we will be having this bony arrangement which is seen in the proximal row, and those bones are, first one is scaphoid, then we will be having lunate, and later we will be having tricutral along with pisiform bone. So these are the bones seen in the proximal row. Now we will move on to distal row bones. So distal row, first bone what you are seeing is trapezium, and the second bone will be called as this is also trapezium's part, that is crest of trapezium. Trapezium, same like scaphoid, we will be having on elevation, that we will call as crest of trapezium. In scaphoid we call as tubercle, which you have to remember. And the second bone which we are seeing is trapezoid. So lateral most bone in the distal row is trapezium. The medial to trapezium we will be getting trapezoid, and then we will be having capitate, and later in the medial aspect we will be having hamate. So these are the bones seen in the distal row. So proximal row, 4 bones such as scaphoid, lunate, tricutral and pisiform. In the distal row, again from lateral to medial we will be having trapezium, trapezoid, hamate and capitate bones. And here you can make out another bone which another prolongation or projection from the bone, that we will call as hook of hamate. So we have some special features in 3 bones such as scaphoid, trapezium and hamate. In scaphoid we will be getting tubercle, in trapezium we will be having crest, in hamate we will be having hook. These are the things you have to remember for our further study of the muscles and all. So now we will move on to the layer which is just above or below the superficial fascia. We will be having the fascia. So first we are approaching skin, later we will take off skin, we will be having superficial fascia, and if you remove the superficial fascia also, you will be getting into another layer of fascia called deep fascia. So in deep fascia we will be having some important features seen in this area. Those are, it is specialized to form flexor retinaculum, which we already dealt. So then we will be having, this is flexor retinaculum, and then we will be having palmar aponeurosis and fibrous flexor sheaths in fingers. And these flexor sheaths are mainly for holding the tendons in position, and also this palmar aponeurosis is going to increase the grip of the hand to hold an object. So these are the importance of deep fascia present in hand region, which is modified as flexor retinaculum, palmar aponeurosis and fibrous flexor sheaths. The importance are, it is holding the tendons in position and it is increasing the grip. Now we will move on to flexor retinaculum. We have already finished this topic, still we will just brush up those things what we have seen earlier. So flexor retinaculum, it is a strong fibrous band, as you already know, and it makes carpal arch into a tunnel. So carpal bones are going to give a depressed area, and above this we will be having the attachment of flexor retinaculum, which is turning the area into a carpal tunnel. And the attachment of flexor retinaculums medially and laterally we will be having two carpal bones giving attachment. So medially we will be having pisiform and hook of hamate, that is distal and proximal row bones which are present medially are giving attachment for flexor retinaculum, and laterally we will be having tubercle of scaphoid and crest and medial lip of groove on trapezium. All these are going to give attachment for this flexor retinaculum in the lateral aspect. Scaphoid and trapezium are giving attachment laterally. To tell detailedly you have to describe, it is in the tubercle of scaphoid and in the crest of trapezium. So here you can make out the image properly. So this is carpal bones. Carpal bones, above the carpal bone you can make out the attachment. This is lateral side and this is medial side, pisiform bone and hamate here, and here we have trapezium and scaphoid. So these are the pictures of flexor retinaculum. You can see clearly. So this is flexor retinaculum. This will be called as carpal tunnel. Here we will be having some structures passing through the carpal tunnel, which we already dealt. We will be having tendons, nerve and major tendons such as arranged in two groups superficially and deep. So now we will see those things, that is structures passing superficial to flexor retinaculum. So above the flexor retinaculum we will be having some structures passing. Those are palmaris longus, palmar cutaneous branch of median nerve, palmar cutaneous branch of ulnar nerve and ulnar nerve with vessels. All these structures are passing above the flexor retinaculum. Now we will move on to structures passing deep to the flexor retinaculum. So first structure is median nerve, tendon of flexor digitorum superficialis in the upper layer, and in the deeper layer we will be having flexor digitorum profundus. Along with these two tendons we will be having flexor pollicis longus tendon also, and then we will be having ulnar and radial bursa and also flexor carpi radialis. So these are the structures passing deep to the flexor retinaculum, or you can tell contents of the carpal tunnel. And then we will move on to palmar aponeurosis. So deep fascia thickening we are seeing. First thing what we seen is flexor retinaculum and their structures passing through. Now we are going to see palmar aponeurosis seen in the palmar surface, and this is also a modification of deep fascia, which is triangular in shape, and the apex is proximally placed, base is distally seen, and four slits which again divides into two. You can make out this clearly. So this is the apex part of palmar aponeurosis, this is the base part, and here we will be having four septa arising, and these four septa again near to the digits it is going to divide into two again. The structures emerging between these two slips are digital vessels and nerves along with lumbricals muscles. So here the image is clear. This is the cadaveric view. Here you can see palmar aponeurosis with four septa, and here it is going to split into two, and between the septa you can see digital vessels, and we will be getting nerves also passing through this. So this palmar septa divides the palm again into some compartments, and morphologically this palmar aponeurosis is nothing but degenerative tendon of palmaris longus, so which we already seen before, and the function of this is it is going to fix the skin, which is again increasing the grip, and then it protects the underlying structures, especially vessels and nerves. And now we will be seeing some applied aspect for this palmar aponeurosis, that is Dupuytren's contracture. It is mainly due to, if you are seeing an inflammation in the ulnar side of palmar aponeurosis, that condition we will call as Dupuytren's contracture. So what will happen there is the aponeurosis will get thickened and it is contracted. So what will happen? The result will be proximal and middle phalanx will get flexed as shown in the image, and the ring finger is major finger to get affected. So ring finger and little finger is usually affected because it is present in the ulnar side, and the major thing is proximal and middle phalanx will get flexed in this condition. The important finger which is getting affected is ring finger. So these are the superficial structures of palm region. We will be having vessels and nerves, which is seen just below the palmar aponeurosis. Now we will move on to intrinsic muscles of hand. So I think you people are having a orientation about how the muscles are arranged. Now we are going to see a detailed account. So as I said earlier, we will be having intrinsic muscles as 20 in number. So we will be dividing that into 5 groups, so such as thenar muscles, hypothenar muscles, lumbrical, palmar interossei and dorsal interossei. Thenar muscles are again 4 in number, such as abductor pollicis brevis, flexor pollicis brevis and opponens pollicis along with adductor pollicis. And among these 4 muscles, we will be having only 3 muscles which are going to contribute for thenar eminence. Those are abductor pollicis brevis, flexor pollicis brevis, and opponens pollicis. Talking about hypothenar muscles, again these are 4 in number, and those we will call as abductor digiti minimi, flexor digiti minimi, opponens digiti minimi, and palmaris brevis. Here we will have eminence formed by abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. Here we have to exclude palmaris brevis because it is not going to contribute for eminence. In thenar muscle we are excluding adductor pollicis, which is again not going to contribute for thenar eminence. And the next set of muscle is lumbrical, which is again 4 in number. In lumbricals you have to remember we will be having first 2 lumbrical is unipinnate and third and fourth lumbrical are bipinnate. Talking about palmar interossei, it is again 4 in number and all the muscles are unipinnate muscle. Talking about dorsal interossei, this is again 4 in number and these muscles are bipinnate in nature. And talking about thenar muscles. So thenar muscles, as I said before, we will be having 4 in number: abductor, flexor, opponens, and adductor pollicis. In this, you have to remember all these muscles having a common origin. They arise together from flexor retinaculum and also from lateral 2 bony pillars of carpal tunnel, that is tubercle of scaphoid and crust of trapezium. So to commonly remember this, you have to remember in this easy way, that is it is taking origin from flexor retinaculum and also from the lateral aspect, 2 bones that is present in the carpal region. One is scaphoid and another one is from trapezium. And we will be having little finger. So that is again having 4 muscles, as I said, abductor digiti minimi, flexor and opponens digiti minimi, and another one will be palmaris brevis. Here palmaris brevis is nothing but a subcutaneous muscle which is taking origin from fascia and getting inserted into fascia. Now we are going to talk about eminence muscle. So this eminence muscle are arising again from flexor retinaculum and taking origin from medial bony pillars of carpal tunnel, that is pisiform, and then we will be having hamate. So these 2 bones are important for the attachment or origin of digiti minimi muscle. So talking about other important muscles, about their detailed account of origin and insertion. So just you remember a common origin for all those thenar eminence and hypothenar eminence muscles. Now we will see detailedly about important muscles present in the palm region, that is adductor pollicis. So it is one among the thenar muscle which is not contributing for eminence. So we will be having origin of adductor pollicis happening by 2 heads, such as oblique head and transverse head. So in this image it is clear that one head, it is coming as an oblique arrangement of fibers that we will call as oblique head, and this part we will call as transverse head. So oblique head, it is taking origin from capitate bone and also from the base of second and third metacarpal bones, and also transverse head, it is taking origin from the metacarpal bones palmar aspect, that is third metacarpal bone. It is giving origin for this particular head of adductor pollicis. So we have 2 heads for the origin of adductor pollicis. One is oblique, another one is transverse. And oblique head, it is taking origin from carpal bone capitate and also from the base of second and third metacarpal bone. Transverse head, it is taking origin from palmar surface of third metacarpal bone. Talking about its insertion, as the name itself it indicate that it is going to insert in pollicis finger. So medial side of the base of proximal phalanx of thumb is getting insertion of this particular muscle. So insertion, it is happening in the medial side of the base of the proximal phalanx of thumb region. Here you can make out. So here we have insertion of this particular muscle, and then it is going to contribute for dorsal digital expansion also by getting inserted in that particular area. Then talking about the action, this is the major muscle for adduction of thumb. So name that's why we are calling this muscle as adductor pollicis. Adduction of thumb is the major action. Talking about its nerve supply, it is supplied by ulnar nerve. So in hand region, if you take nerve supply, we will be having only 5 muscles getting its nerve supply by median nerve. All other muscles are getting its nerve supply by ulnar nerve. So one among that is adductor pollicis. Now we will move on to another set of muscle, that is lumbricals. So lumbrical muscle, as I said before, it is 4 in number, and first 2 lumbrical are unipinnate, and third and fourth will be bipinnate. The origin of these muscle are taking from tendon of flexor digitorum profundus. It is not from bone, it is taking origin from tendon of flexor digitorum profundus, which is very important for you people to remember. So origin of lumbrical muscle is taking from tendon of flexor digitorum profundus. Talking about its insertion, it is inserting into radial side of the dorsal digital expansion of medial forefingers. So you have dorsal digital expansion in the palmar surface. So in the dorsal digital expansion, radial side of it, giving insertion for this particular muscle. So here you can make out lumbrical muscle, worm-like muscle, so we are calling it as lumbricals, taking origin from profundus tendon and getting inserted into the radial side of dorsal digital expansion. The action of this muscle is flexion at metacarpophalangeal joint and extension in the interphalangeal joint. So two actions are made in two joints. In metacarpophalangeal joint we have flexion, in interphalangeal joint we have extension. Now we will move on to other importance of lumbrical muscle. As I said before, first and second lumbrical are unipinnate in nature. So one side only fibers you can make out. So here third and fourth lumbricals are bipinnate, and we have nerve supply also different. First and second lumbrical are supplied by median nerve, third and fourth is supplied by ulnar nerve. Now we will move on to another muscle called palmar interossei. You know, interossei muscle, we have 8 in number. We are dividing into palmar interossei and dorsal interossei. First set of muscle what we are going to see is palmar interossei. So origin of this particular muscle, it is taking origin from, that is first palmar interossei, it is taking origin from ulnar side of the base of first metacarpal bone. So here you can make out palmar interossei, first palmar interossei taking origin from the ulnar side of base of the first metacarpal bone. And coming to the second palmar interossei, it is from again ulnar side of second metacarpal bone. And talking about third and fourth, both are from the radial side of shaft of fourth and fifth metacarpal bone. In third metacarpal bone, we will not have any attachment of interossei muscle, especially palmar interossei. So all the palmar interossei are unipinnate in its nature. And talking about the insertion of palmar interossei, it is getting inserted into base of the proximal phalanx of corresponding digit on same side of the origin. From where it is taking origin, that is first and second, it is taking origin from ulnar side. So insertion also happening in the ulnar side of the base of proximal phalanx. Third and fourth, it is taking origin from radial side. So insertion also happening in the same side in the base of the proximal phalanx of particular metacarpal bone. Phalangeus bone. So now talking about the nerve supply. So nerve supply of this palmar interossei is, so here you can make out the image. These are the palmar interossei, and here you can see clearly all the four palmar interossei. Here also first, second, third and fourth. And this palmar interossei is also supplied by ulnar nerve. Now talking about dorsal interossei. So palmar interossei, we have unipinnate muscle fibers. Here we have bipinnate muscle fiber. The dorsal interossei taking origin from adjacent sides of the shaft of first to fifth metacarpal bone. So all the metacarpal bones are contributing for the origin of dorsal interossei. The insertion is going to happen in the first and second first and second dorsal interossei to the lateral side of index and the middle finger, and third and fourth to the medial side of middle and ring finger. This thing you have to remember, by image only you can see clearly. So first and second, it is going to the lateral side of the index and middle finger, and third and fourth to the medial side of the middle and ring finger. The action of this particular muscle is abduction, and also same like lumbricals, it is going to flex the metacarpophalangeal joint and extend the interphalangeal joint. These are the some images of dorsal interossei. All the muscles are bipinnate, you can see here, and these are the dorsal interossei muscles. And talking about the applied aspect, carpal tunnel syndrome is the major applied aspect, where it is caused by the compression of median nerve in the carpal tunnel, and I will be having some condition called motor changes, sensory changes and vasomotor changes, and this syndrome is common in females, and the pain distribution is along the way of median nerve. Now we can see what are the changes or what are the impact going to happen due to this carpal tunnel syndrome. The motor changes are, we will be having wasting of thenar muscle and aphthum deformity. These are the motor changes. Then we have sensory changes such as loss of sensation in the lateral one third, lateral three and a half fingers, such as which are supplying the median nerve. So sensory supply of the median nerve in palmar region are going to get affected. Talking about vasomotor, we will be having loss of sympathetic supply, which is going to cause dry and warm skin. So this is, in this image you can make out another importance, that is Guyon's canal or ulnar tunnel syndrome, where ulnar nerve will get compressed. So here we can make out in this image above the flexor retinaculum we will be having some ligamentous origin and which is going to transmit ulnar nerve and its vessel. So thank you. We will deal with nerves and vessels detailedly in next class.